I have rosacea that flushes easily and occasional eczema patches on my cheeks. Will filler injections trigger flare ups? And are there products or techniques that work better for sensitive, reactive skin? While chronic inflammatory skin conditions require thoughtful filler planning, treatment is usually possible, but the timing and approach need adjustments. Active flare ups are absolute pause points. Rosacea creates persistent facial redness and flushing from dilated blood vessels and chronic inflammation. The trigeminal nerve runs sensitized in many rosacea patients. Filler injection in sensitized tissue can cause prolonged redness, increased swelling, and more visible bruising than in non rosacea skin. Treatment timing for rosacea patients should fall during stable periods. If you're in a flare up with active flushing, papules, or pustules, wait for resolution. Treating during flares amplifies inflammation and can extend recovery time substantially. Product selection matters. I avoid products like Radius and other calcium hydroxyapatite fillers in patients with significant rosacea. The inflammatory response of calcium hydroxyapatite or CAHA can trigger rosacea flares. Hyaluronic acid products generally work better in reactive skin. Eczema requires similar caution. Active eczema patches mean delayed treatment. The compromised skin barrier allows easier bacterial entry at injection sites. Wait until your skin is in stable, intact state. Pre-treatment skin prep becomes more important. I use longer chloroxidine cleansing time for sensitive patients with active rosacea or eczema skin. Anti-inflammatory pre-treatment with topicals or oral medications can reduce flare risk. At Glow by Elena Reitman MD, my consultation for inflammatory skin conditions include a detailed history of triggers, frequency, and current management. I want to know what your dermatologist is currently using for control and recommend certain regimens. Cannula technique is also preferable to needle techniques for these patients when possible. Fewer entry points means less tissue trauma. Less trauma means lower flare risk. The blunt cannula tip also navigates around sensitive tissue more gently. Post-treatment care should include continued use of your prescribed topical medications. Don't pause your tretinoids, metronidazole, or other prescriptions because of injections. They actively suppress the inflammation we're trying to avoid. Aftercare also includes strict sun avoidance and gentle skin care for the first week. Heat exposure, alcohol, and harsh products all increase flare-ups or probability of flare post-injection.